Bhavya from Instutors. A great hello to all of our courageous people who are sitting for MRCG Part 1, July 2024. And I really want to appreciate you guys for taking this brave step. I'd really appreciate if you guys respond to me. How are you all doing? That's really nice to know. Dr. Kiran, Dr. Khadija, Dr. Noor, Dr. Nusra, thank you so much for your responses. Um, could you please try increasing the volume of your phone or any device that you're using? Am I not audible enough? Please do let me know so if there's any technical issue and so our backend team can fix it. Okay, thank you so much. So, welcome to our premium exam preparation session, which is exclusively conducted only for you for free. Thank you so much for being with me. Okay, so now let's introduce our very wonderful mentors who are working really, really hard for you guys to help you pass this exam in one go. So let's welcome our Dr. Sumbal Ijaz and Dr. Grishma. Hello there, Dr. Sumbal and Dr. Grishma. How are you?
Hello, I'm fine. How are you?
Am I audible to both of you?
Yeah, you're audible.
Okay, so please could you introduce yourself to the audience?
Yeah. Hello, everyone. I'm Dr. Sumbali Jaz, your MRCG 1 mentor by Med Institutors. I'm happy to see you all of you here today. Thank you for joining us, and I hope you're all doing well.
Hello everyone. Hi, can you hear me?
Yes, Dr. Grishma, you can.
I'm Dr. Reshma. I welcome you all to the premium session by my Instutors. This is the best course for you all people to pass your MRCOG Part 1 in a go. So I wish you all best of luck.
Thank you so much, Dr. Grishma and Dr. Sumbal. Could you please give me 5 minutes so we can connect you? Ali from backend team, could you please make Dr. Sumbal and Dr. Grishma co-host so they can share their screens? Okay, you both are now co-hosts. Dr. Sumbul, could you please give us a few minutes so we could go live on our Facebook page? Then
Yes.
you can start. Okay, thank you. Ali from the backend team, please go live. And everybody, if it's possible for you to rename, so it's better if you come with your real name, so it's easier to address you guys. Okay, Dr. Zimbal, we are now live. You may start now.
Okay. So once again, I'm going to introduce myself. I'm Dr. Simbali Jas, your MRCOG1 mentor by Med Instutors. I'm happy to see all of you, and I hope you are all doing well. I'm excited to share that we will be diving into our premium exam preparation course for MRCOG Part 1. Today's session, it is designed to provide you with detailed understanding of the course content, study strategies, and exam format tailored specifically for the MRCOG Part 1 exam. While the session is typically part of our premium course, we have decided to make it free for all the attendees because we believe that everyone should have access to the tools and knowledge needed to excel in this exam. Throughout our time together, we will cover essential topics such as effective study techniques, study material, which is recommended by RCOG, and a comprehensive overview of RCOG curriculum, ensuring that you are well equipped to tackle the exam with confidence. So let's start. Dear candidates, I have been through this phase when I was writing my Part 1 exam. So some of the queries which is very natural, which came into your mind when it comes to starting the exam preparation. I know uh, I find myself feeling overwhelmed with all of the things I think I need to pass the exam. I know I will require course material, how to access to the updated question bank and recorded lectures, plus joining study groups or platforms like Facebook or Telegram. Uh, these things seems essential, and of course, having a scheduled course and a mini schedule for daily tasks, feeling these things were feeling necessary that we should have that before we start preparation for the exam. But where my anxiety kicks in, I'm not sure where or how to get all of these resources. Do I need to ask different people? Should I follow or join different social media platforms? Whose guidance should I follow or should I trust? I'm feeling really nervous about making the right choices and choose between helpful advice and distractions. I just wish this process could be simpler and more straightforward. The solution to all of your exam anxieties here, we at Med Instutors, in collaboration with RCOG examiners, have developed a premium MRCOG1 course specifically designed to address every challenge a candidate might encounter while preparing for this exam. What we are going to offer. So the first and the foremost thing is the course material. This is one of the biggest challenge every candidate face whenever they're going to plan to write any exam, any global exam. So first thing is course material. So we are going to provide you with the study plan, the live sessions, which are particularly teaching sessions on the Zoom meeting, We are also going to provide you those recorded lectures, books which are updated in the PDF form, subject-wise pool, subject-wise recalls. So this is the first time we are going to provide the subject-wise recalls. And also we have PDF, which is the PDF, which is the recorded lectures available in the PDF form. We're also going to provide that. And the important thing is the mock exam. We are also going to offer all of these things under just one course. The second thing, website access. So as you can see here, we have a section of live session recordings in which you're gonna have the recorded lectures the day after the live session have been conducted. On the very next day, you can watch the recorded sessions on the website. Then you can see in the second section, the books, all of the study material which is recommended by RCOG available in the updated versions on the website. In the third section, you can see subject-wise recalls. And again, this is the first time anyone is going to launch the subject-wise recalls. As you can see, we have already uploaded anatomy recalls, physiology recalls. Then we have the subject-wise question bank. Later on when I will guide you about the course schedule and the mini schedule, I will tell you how you are going to tackle and how you can utilize this website one by one. Then in the last section, you can see the PDF and notes of all the subjects. So now you can see this is so concise, and this is one-stop destination. All you need to do is just to go to the website, and you have access to all the material. The third challenge that every candidate might face during the exam preparation, I have been through this phase, what social media platform should I join, which one is the authentic, and who is guiding the best on the social media. So we sort out this thing, and we made a good quality content social media account on the Facebook. We have this page on the Facebook in which you can see we have already posted the schedule, the very first schedule on the Facebook page. You can see, you can check that there. The next we have, okay, so this is a very convenient thing. If you want to search for any particular topic, for example, you want to find some questions from anatomy, all you have to do is type #anatomy, and you will have the list of all the questions which have been posted in the group. Likewise, if you want to go through from the physiology question, again, you have to type #physiology, and you have all the questions below in the main page. Again, this is our Facebook page. We have shared course schedule, and again, type #schedule, and you have that schedule. Then on the Facebook page, we have posted our mini schedule. I'm going in a few minutes, I will tell you everything in detail about the course schedule and the mini schedule. For now, just have a look at how our Facebook page looks like, what kind of material we are going to update on our Facebook page. So again, our website is one-stop destination, and our Facebook page is also one-stop destination. You can have access to all the study material you need to pass the exam in first go. If you want to find any book, yes, you have the option of website. If not, then you can go to the Facebook page, type #books, and you will have the books under your search bar. Now comes our Telegram group. The candidates who don't choose Facebook much, or those who don't prefer Facebook much, prefer Facebook, they can go on the Telegram. It has the same format. It works more like the WhatsApp. The difference is you will have all the study material on the file segment, or again, you can simply type hashtag schedule, you will get the schedule. And likewise, if you type hashtag books or hashtag any particular subject, you will have all the material relevant to that subject. Again, our Telegram group is also the one-stop destination like our website, our Facebook page, and our Telegram group. So this is the main, this is the limelight of our schedule. Our course, our MRCG Part 1 course is our course schedule. As you can see here, we have divided different modules into different number of days according to their weightage on the RCG curriculum. Have a look and see how we divide the subjects into number of days. This is just a sample. We have the whole schedule for the whole RCOG curriculum. As you can see here, we have the anatomy first, then we have genetics, then embryology, physiology, and biochemistry. Okay, let's go in the deep knowledge. Let's take anatomy as an example. We will begin with the live interactive teaching section focused on anatomy on the day 1 of our schedule, which is on the 1st of March. Following that, we will engage in SBA practice. Then we will make onto a subject-wise recalls. Once we have covered everything, like teaching session, our SBA practice, and the anatomy recalls, once we have covered everything, you will have the opportunity to visit the website and take a mock test specifically tailored to the anatomy. The same approach applies to the other modules as well. As you can see in the genetics, we have again the same pattern, the live session, which is the teaching session of genetics, then SBA practice of genetics, then the genetic recalls, and then the genetic mock exams. Likewise, you will cover rest of the modules. So this is a broad picture of our course schedule, in which we're gonna cover every subject for the rest of our course. Now, this is another innovative thing. The Med Instutors, have provided you candidates, which is the mini schedule. Let's take a quick glance on our mini schedule. We will provide each and every candidate with the personalized mini schedule to follow. This will enable them to track their progress and identify the areas where they may need additional focus in their preparation. And don't worry, we are here throughout your journey. 24/7 technical and any assistance is available. So anytime if you need any help, all you have to do is just drop a text on our WhatsApp group, on our Facebook group, or on the Telegram group. Moreover, having a mini schedule will serve as a motivational tool as it emphasizes the importance of completing daily tasks and strategy on track with their exam preparation journey. So this is a self-motivational tool as well. Like as you can see here, this is the sample from the anatomy mini schedule. We have made this for 11 days. And in each of the segments, you can see the day, and the name of the topics you're going to cover that day. So it would definitely help to track your progress, that how much you are lagging behind the schedule. And it would also make a sense of competition among other candidates as well. Like if one person is strictly following the schedule, you can easily compare yourself that where you are lagging, and it would help to improve yourself and your exam preparation. And on the last day, as you can see, we have arranged the mock test of anatomy. So this is how we are gonna cover each and every module. Before before starting anatomy teaching, I had like to provide you with an overview of RCOG curriculum, which serve as the foundation for your exam syllabus. RCOG has categorized the knowledge requirement into 15 distinct areas. I'm going through one by one. As you can see, they have divided knowledge area 1, 2, 3, and in the coming slides, we have up to 15. As you can see, we have 15 distinct areas. So this is your exam syllabus, and we have to cover the syllabus in our course. So number one, knowledge area 1 is the clinical skills. I'm not going into detail in each knowledge area, because as we are progressing with our module, we will take a deep dive into one by one. As today we are going to start anatomy, so my focus would be on the anatomy. So let me find where we have anatomy in our RCOG curriculum and what information they are expecting from us on the day of the exam. So one is clinical skills, teaching and research, core surgical skills. Then we have post-op care, and in the post-op care, I highlighted the topics from the anatomy. So they have asked uh, the topics which are included in RCOG curriculum simply means that RCOG is expecting this knowledge on the day of the exam, so you should be prepared. So the number one, I highlighted this from the knowledge area 4, which is post-op care. They have clearly mentioned histopathology of the pelvic organs, the breast, endocrine organs, including the pituitary and the hypothalamus. So you should be knowing this topic. Then we have in the module 5, knowledge area 5, antenatal care, maternal, anatomical, endocrine, and physiological adaptation occurring in pregnancy. Since we are more focusing on anatomy, so we have to focus on maternal anatomy for now. Later on, we will cover the rest of the topics when we are going through the endocrinology or physiology and so on. Then I highlighted fetal anatomy. So we have to cover fetal anatomy while we are doing general anatomy. Okay, no anatomy topic from knowledge area 6 or 7. Okay, now we have another anatomy topic, female perineum and principles underlying the management of perineal repair. In the knowledge area 10, we have anatomy of the female reproductive, including understanding of changes at puberty and at menopause. Then we have anatomy topic under knowledge area 11, anatomy, development, function, and cell biology of the organs of the male and female reproductive tract in context of their relevance to fertility and its disorder. Then we have surgical anatomy of abdomen and pelvis. So it's very, very obvious that RCOG is expecting the anatomy of abdomen and pelvis. And previously we have read that they are asking about anatomy of perineum as well. So these are the main regions we have to focus while studying anatomy for MRCOG Part 1 exam, which is, I'm repeating, abdomen, pelvis, and perineum. So this is a simplified way to study anatomy, that we should focus on high yield topics. Then we have pain pathways, transmission of pain centrally, and pathology of pain in gynecological malignancy. This topic covers under the section of neuroanatomy, which we are also going to cover under anatomy subject. Then we have in area 15, urogyny and pelvic floor problems, structure of the bladder, pelvic floor and their innervation, mechanism of continence and micturition, and principle of pelvic floor support. So we have to cover these topics. Okay, so now I'm going to start anatomy. Okay, today we will be discussing an important content of the front of the thigh, which is femoral triangle. The objectives of femoral triangle would be boundaries of the femoral triangle, contents of the femoral triangle, femoral sheath, and femoral canal. So the purpose of this teaching video is that you should have an idea how we are going to teach you and how we are going to tackle theory and how we are going to extract SBAs from the theory so that we ace the anatomy and we are able to pass this exam in the first go. So this is all about strategy and the proper guidance. So let's start about femoral triangle. As you can see here in the diagram, this is the exact location where femoral triangle is located in the anterior aspect of the thigh. The femoral triangle is a wedge-shaped area formed by a depression between the muscles of the thigh. It is located on the medial aspect of the proximal thigh, as you can see here and here as well. It is the region of the passage of main blood vessels between the pelvis and the lower limb, as well as large nerves supplying the thigh. So this is the purpose of femoral triangle, why it is there. So our first objective, which is the boundaries of the femoral triangle. I'm gonna show you some pictures, some diagrams, and the 3D model of the femoral triangle so that you would retain this topic at least until the exam day. So the boundaries of the femoral triangle can be remembered using the word sail, as well as these boundaries. The femoral triangle also has a floor and a roof. So the femoral triangle have a lateral border, medial border, a base, as well as floor and a roof. So total we have 5 boundaries of the femoral triangle. I have mentioned the mnemonic sail, how how it is bound. The femoral triangle is bounded by these structures. Let me clear. Lateral border is formed by the medial border of the sartorius muscle. Medial border, it is bounded by the medial border of adductor longus muscle. Base is bounded by inguinal ligament. Base or superior border is bounded by inguinal ligament. The floor is comprised by 4 muscles that can be easily remembered by using mnemonic APPI, which is adductor longus, pectineus, psoas major, and iliacus muscle. The roof is formed by the facial lata, superficial fascia, and the skin. So this is the covering. If we go from outside to inside, we have skin, then superficial fascia, and then the facial lata. The apex of the triangle is pointed towards the adductor canal. I know this is not making sense at the moment, but once I will show you the figures and the 3D model, everything would make sense. This is just for the overview that you should know how many borders femoral triangle do have and what structures are bounded by it. Now, this is the most simplified diagram of the femoral triangle. Now you can see. Here, this is the superior border of the femoral triangle. As you can see, it is wedge-shaped depression in the medial aspect of the thigh on the anterior side. This is inguinal ligament, which is making the superior border. Then on the lateral side, we have sartorius muscle. On the medial side, we have adductor longus. And in this picture, these are the main boundaries you need to remember. As I told you, the roof is formed by the skin, superficial fascia, and the facial lata. And floor is formed by the 4 muscles. The mnemonic we have for adductor longus, pectineus, psoas major, and iliacus muscle are forming the base of the femoral triangle. Now, the contents of the femoral triangle. I have colored the nerve with brown, artery with the red, vein with the blue, so that you can, this would have in your visual memory. The first content is the femoral nerve, which is the most lateral content in the femoral triangle. It originates from the union of L2, L3, L4 spinal cord segment in the lumbar plexus on the posterior abdominal wall. The purpose why I have mentioned the origin of the femoral nerve, because it is an important SBA. Everything you need to know about the femoral triangle and which is important for the exam purpose, I have mentioned everything in these slides. If you're going to remember these slides, then definitely you can solve any SBA from the femoral triangle in your exam. So try to focus and listen carefully. The nerve, femoral nerve, is the first content of the femoral triangle, and its origin is L2, L3, L4. Then we have the femoral artery, which is the continuation of the external iliac artery. This is another SBA. They have this SB in the past recalls. That femoral artery is a continuation of external iliac artery in the thigh, becoming the femoral artery as it the main blood vessel supplying the entire lower limb. Then we have the femoral vein in the proximal continuation of popliteal. Okay, so the vein comes from downwards. The femoral vein is not coming from the abdomen, it is coming from the lower limb. It is the proximal continuation of the popliteal vein. It enters the thigh from the popliteal fossa, which is behind the knee joint, through the adductor canal. Here is another mnemonic. The word navel is used as a mnemonic to orientate the contents of the femoral triangle from lateral to medial as follows. As you can see, navel stands for femoral nerve, A stands for femoral artery, V stands for femoral vein, E stands for femoral canal, which is an empty space, and L stands for lymphatics. So here is another SPA. What they usually do, it seems like very simple and straightforward information, but MRCOG1 is a very unexpected exam. They trick you with a very simple information and you lose a very simple SPA. So, for example, here we have listed and made this mnemonic from lateral to medial. Sometimes they give you in the option the same arrangement, but they twist here. They made a twist here. They ask you about medial to lateral relation. So in that way, you have to reverse the order of all the contents. Otherwise, you would miss the SPA. So this is a very high yield topic, the contents of femoral triangle. We can make plenty of SBAs out of this topic just from the contents, just by twisting simple information. This is the diagram in which we can see the borders of the femoral triangle as well as the contents of the femoral triangle. Let me repeat. Here we have on the lateral side is the pectineus muscle. Here we have the adductor longus muscle, and we have the inguinal ligament, which is making the superior border. And here we complete the wedge-shaped depression on the anterior aspect of the thigh, medial thigh. Now moving on to the next contents of the femoral triangle, you can see from the lateral to medial side, we have femoral nerve. We have to complete the mnemonic navel. So nerve, femoral artery, femoral vein, and then if anybody knows what is the screen structure, please do let me know in the chat box. Okay, it's labeled in the diagram, by the way. So this is the femoral sheath. Here we have some SPAs. Femoral sheath, as you can see here, do not cover the entire contents of the femoral canal. It just covers roughly about 4 centimeters of the contents of the femoral triangle. And it is very obvious this femoral sheath do not involve femoral nerve. So here is the SPA. All of the following are present within the femoral sheath except. So you have to rule out femoral nerve. Femoral nerve is not the part of the femoral sheath. Okay, so here you can see a femoral branch of genitofemoral nerve. Is that the part of femoral sheath or not? Here you can see. this small nerve is the femoral branch of genitofemoral nerve? The answer is yes. This branch is a part of femoral sheath because it supplies a superficial area in the skin of this area of the femoral sheath. So this nerve is very important here. Only the femoral nerve is not part of the femoral sheath. Okay, in the diagram, you can see here another thing, which is femoral canal.
We are here to interact and practice. Please continue, Dr. Sambal. Thank you so very much.
Welcome. So we were at femoral ring and femoral canal. So let me repeat everything, just a brief. We have done up till now the boundaries of the femoral triangle, which is the adductor longus, sartorius, and the inguinal ligament. Then we have done the contents of the femoral triangle, which is femoral nerve, femoral artery, femoral vein, and the lymph nodes. Then we have noticed something green on the upper 4 centimeter of the femoral, the contents of the femoral triangle, which is femoral ring, femoral sheath, which is femoral sheath, which is simply a fascia from the abdomen. I'm gonna tell you in detail about the femoral sheath and femoral ring and femoral canal. For now, just memorize this diagram. This is an important diagram. And I explained this thing that femoral nerve, this is an SPA, that femoral nerve is not the part of femoral sheath. And this is very obvious. Femoral sheath only covers the artery, vein, and the lymph nodes. And you can see on the most medial side, we have the femoral canal. This is a very tiny canal, which is conical in shape and present in the upper part of the thigh.
Sorry, ma'am. Ma'am, excuse me, but I had you said femoral branch of femoral nerve is covered, but a branch of the nerve, is it part of the sheath or is not? You said genitofemoral nerve?
Yes.
Okay.
Yes, the simple thing there is a simple way to remember this thing, that genitofemoral nerve supplies the skin and the area of the femoral canal and the femoral sheath. This is the nerve innervation of the femoral sheath. So since it is the innervation of the femoral sheath, it has to be the part of femoral sheath. Only the femoral nerve is outside the femoral sheath. Am I clear?
Yes, ma'am. Thank you.
Welcome. Okay. In the femoral triangle, the contents, excluding the femoral nerve, are enclosed in a wrapping fascia called the femoral sheath. The sheath is funnel-shaped and best described as a sleeve of fascia extending towards the apex of the femoral triangle, where it fuses with an adventitia of the vessels. It is continuous spirally with the transversalis fascia and iliac fascia of the abdomen. In the later diagram, I will show you. This is the femoral sheath. As you can see, it is green in color. It is extending from the lower part of the abdomen to the medial of the thigh. Anteriorly, it is lined with the fascia transversalis, and posteriorly, it is formed by the fascia iliaca. So this is all about femoral sheath. Each of the structure located in the femoral sheath is individually enclosed in its own compartment. The most medial compartment is the femoral canal, which contains the lymphatic vessels. The proximal opening of the femoral canal is the femoral ring. So femoral ring is simply the opening of the femoral canal. This is a better picture. As you can see here, this green color, one more time, is the femoral sheath. Now, it's very obvious. You can see femoral branch of genitofemoral nerve is present within the femoral sheath. Then we have the artery, femoral vein, and the femoral, the lymph nodes. There is no femoral nerve inside the femoral sheath. I repeat, this is an important SPA. Don't miss out. And the most medial part is the femoral canal, and in the femoral canal, we have lymph nodes of Cloquet or Rosemuller lymph nodes. Just simply remember the lymph nodes are present in the femoral canal, and it is the most medial part of the femoral sheath. I know it's a bit tricky in the beginning, but once you know the very basic and you remember the thing logically, then you would never forget this topic. This is tricky but easy topic. This is the upper view. As you can see, the femoral sheath is enclosing each and every component individually by making septas in between them. You can see here the septas. This is artery. This is nerve, genital branch. This is femoral branch of genitofemoral nerve. This is the femoral vein, and this is the femoral canal, which contains the lymph nodes. That's it. This is all about the femoral triangle, contents of the femoral triangle, femoral sheath, femoral canal. One thing we are left with is the femoral ring. The femoral ring is simply the upper part of the femoral canal. Or you can say the opening of the femoral canal is femoral ring. That's it. One more time, femoral canal. The femoral canal is the smallest anatomical compartment located in the most medial part of the femoral sheath. It is approximately 1.3 centimeter long. The opening in the femoral canal is located at its superior border known as femoral ring. What is femoral ring? The femoral ring is closed by a connective tissue layer, the femoral septum. The septum is pierced by the lymphatic vessels exiting the canal. Cloquet's node is a lymph node situated in the femoral canal. So this is all about, you need to remember about femoral triangle, femoral canal, femoral ring, and femoral sheath. That's it. Here you can see, I wanted to show you femoral canal because I know sometimes you confuse these terms in terminologies. So in yellow color, you can see in the most medial side, you can see here is the femoral canal. This is the femoral canal. And this is the femoral sheath enclosing vein and artery. And nerve is the outside the femoral sheath. This is another picture. Again, femoral nerve. This is femoral sheath in yellow color. Femoral nerve is outside the femoral sheath. An artery, vein. Then we have the femoral canal on the most medial side where we know that where lymph nodes are present. And the opening of the femoral canal is femoral ring. That's it. Okay, I wanted to show you a 3D model. It hardly take 3 minutes, 4 minutes or so. Let me play this. Okay. Okay, so I hope this topic is clear now. Now, if you have any question, you can ask me. I'm gonna see in the chat box, and then we will start our SPA practice. Okay. Okay, Dr. Faiza, femoral ring is just the opening of the femoral canal. Welcome. Please, if you want to ask any question, you can open your mic. I really encourage, and I really like those students who who are confident enough, and they open the mic and ask the question. In that way, you would learn more. So again, I encourage to open your mic, and if you have any question, you can ask me. And if everything is clear, you can please drop a text in the chat box so that we can continue with the SPA practice. Yep, don't worry. The purpose of the teaching session is that we teach you the topics again like you studied the topics in the MBBS, so don't worry. Okay, let me open this slide. Whose question is this? Okay, Dr. Mona. Let me show you that slide again. Where we have that slide. Okay, SAIL, that's the IL stands for inguinal ligament. As you can see here, sartorius, adductor longus, and inguinal ligament. Yes, Dr. Khatija, I for inguinal, L for ligament. Welcome, Dr. Neap. Okay, I was busy with teaching, so I have missed all the messages in the chat box. I'm gonna read one by one. Let me check if I missed any question. Okay, no question. Dr. Knapp, don't worry. That's why I was repeating the same information again and again, because I know everyone don't have the same temperament. So if you miss the knowledge in the first go, then but in the third time, you will able to retain some of the information. That's why at the end, I played the video, just in case if someone cannot understand the topic well, because anatomy is a tricky subject and it is more retained when you see the things, the diagrams and the videos. It would retain in your visual memory. Okay, please everyone, please drop a text in the chat box that we should continue to the SPA practice. Because I wanted to make sure everyone understand this lecture. We have 35 participants, so at least I want maximum responses in the chat box. Okay, Steffi, I understand you have 4 years of gap. Still, if you spend at least 7 hours in a day, then definitely you can pass this exam in 3 months. That's doable. All you need is the persistence guidance, proper approach, right tricks to solve SBS, then definitely you can pass the exam.
Okay, Dr. Samba, thank you so much for your wonderful session. Do we have Dr. Grishma here?
Yes. Yeah, I'm here.
Okay, should I stop sharing my screen now?
Yes, ma'am.
Okay.
Ali from the backend team, could you please share the screen for Dr. Grishma?
Can I start, Dr. Sadia?
Just a minute. All right, Dr. Grishma, you may start now.
Yes. Okay. Hi, everyone. I'm Dr. Grishma. I am a co-mentor along with Dr. Sumbal, and the previous lecture by Dr. Sumbal was amazing. So she's the best mentor for guiding you people. So coming right now, we'll talk about the tips and tricks to pass.
Dr. Grishma,
Yeah.
sorry for interrupting you, but there is a lot of distortion from your side. Could you please check your device? You're not audible enough.
Yeah. Can you hear me now?
Yes, it's perfect now.
Okay. So after the wonderful discussion by Dr. Sumbal, let's get into the tips and tricks to pass this MRCOG Part 1 exam. So after you have understood, I think you people might have understood the syllabus pattern from what Dr. Sumbal has explained. So the main thing is to understand the syllabus pattern, and the next thing is like you can use our study materials from the website, and we will be discussing, we'll be having the regular participation in the SPA practice as well as recalls in our groups like the Facebook and the Telegram groups. So by participating into the regular sessions with our team, you can definitely crack this MRCOG Part 1 exam with a minimum period like daily of sitting and spending 2 to 6 hours depending upon your availability. Okay. So, however, this exam, the focus mindset is the key for you all people to pass the exam. Dr. Sadia, can we get into the next page? Thank you. So, regarding the tips and tricks to solve the SBAs. I will be telling you, like, whenever you get a question, like, as you have already listened to the lecture of Dr. Sumbal on the femoral canal. So, like, which part doesn't include, like, the femoral nerve is not the content of the femoral canal, right? Femoral ring. So, if you can understand the question what they are asking you can definitely answer the all SBAs at a go. So whenever you are asked in the exam, you have like almost 150 questions. You have like two papers, paper 1 and paper 2. Each contains 100 and 100 questions. So for each question, you get 1.8 minutes to solve it. So the questions are just single liners. So for that to for that question to answer by you people, first you have to read the question. The last line of the question is the most important thing. And after reading the question, try to see, you will have 5 options. So try to look into the 5 options and try to eliminate the incorrect options. And without rushing, you can spend your leisure time of 1.8 minutes over going through the question. And by using your clinical skills and what you have, like what you'll be listening over the lectures, you can definitely answer the question with ease. And by applying your clinical knowledge, you can definitely solve the SBA. So whatever it is, the ultimate key is practice. The more number of SBAs you practice, the more you can give it in your final exam. So I suggest you all people to join into our Med Instutors team and then solve with us daily few questions, so that you'll be more exposed to the variety of questions, and the last exam will be very easy for you to give it in a go. Can we go to next slide, Minhal? Yeah. So of all, the recalls are the most important thing. So though we will be after a session, like after the live session, we'll be practicing SBAs from various books which are described, which are provided to you in our website, and later we will be doing the recalls also regarding that particular topic, so that you will be having all the questions at one place. So after the live session, we do discuss the subject-wise recalls, and after everything is done, we will do the year-wise recalls. And recalls do play a major role in MRCOG Part 1 exam. So by doing the recalls, definitely you can solve almost 70 to 80% of the paper for your final exam. So this will be definitely helpful to you people. So I suggest you to join into the premium group and then solve the SBAs and recalls together with our team, so that it will be very helpful. You can give large amount of topics. Like you can learn large amount of topics in a short period of time by joining into this team where we discuss all the SBAs and recalls after the live session. It will be definitely helpful to you people. Can we go to next page, Dr. Minhal? Yeah. So that is our tips and tricks to solve SBAs and this. And regarding any technical support, you can definitely call to the numbers provided. And you have a wonderful team assisting you from Med Instutors. Yeah. Over to you, Minhal. So for people who are joining it till March 1st, 2024, you have the course fee of $150. So this is exclusive course. Like for people who are interested, I would suggest you to join into this course. So it will be a surprise gift, and definitely you can give your MRCOG Part 1 in a go if you can join with us for $150. And you have this offer till March 1st, 2024. I hope everyone will grab this choice. And best of luck. Let's ace together. Before anything else, preparation is the key to success. Any queries, please?
Everybody, if you have any So this is the tour of our website. This is what all you get in $150. So we are giving you live session recordings, books, subject-wise question banks, subject-wise recalls, and also yearly recalls as well. So if anybody wants to join, they can drop a message in the chat box so we can consider you guys. There will be mocks for every and each module. My apologies. So there will be mock for each module, and there will be 3 big mocks after that. The course is starting from March 1st, and it's going to be lasting till your exam. If you have any other question, please let me know. I'd love to answer you all.
Thank you so much, Sadia, and thank you so much, Minhal, to be with us today and for helping everyone. Before I wind up today's lecture, I just wanted to ask a few SPAs. I just wanted to make sure everyone understands the concept of femoral triangle. So would be that fine?
Yes, definitely.
Yes, I just wanted to make sure. Now, after briefing everything related to femoral triangle, I think everyone should be able to solve any tricky SPA from the femoral triangle. So I'm gonna post a few SBAs. There you go. The first SBA is, which nerve is most commonly at risk during surgical procedures within the femoral triangle? Option A is femoral nerve, B obturator nerve, C is the lateral femoral cutaneous nerve, D is the genital femoral nerve. Okay. So I'm giving 1 minute for the maximum answers. Thank you so much, Dr. Noor, Dr. Niab, Dr. Khadija, Dr. Kiran, Dr. Steffi, Dr. Samira, Dr. Sarah, Dr. Faiza, and Dr. Mona for participating. And we have answers from Dr. Smita, Dr. Mariam, Dr. Tota, Dr. Nervis, and this candidate didn't rename their name, Xiomi M20. Thank you so much, everyone, for participating. However, are you guys done with your answer? So that I can tell you the right answer. Well, this is a demo. Although this exam seems like a very easy exam and everything seems like very pretty straightforward, but I'm afraid
एबल अगर
every...
गर्ल अब अभी देखने को आ सकते हैं मेरे वाला
Sorry?
ऐसे है जी आपका हाल तो ठीक नहीं है मैं कल आया आपको मिलने के लिए अभी कैसा लग रहा है आपको मेडल मास्टर अगर और ఇప్పుడు 25 26 26 27
Dr. Bhanatija, if you don't have anything to ask or answer, can you please mute your microphone?
Okay, please, do we have the maximum answer? Should I proceed with the right answer? If yes, then please do let me know. I love the students who participate in the discussion. I really love those students. And it would help me to remember your name as well. Okay, I think we are done with the answers. So, Dr. Sarah, Dr. Faiza, and Dr. Noor, very well done. A is the right answer. A is the right answer, which is femoral nerve. It's not D, however, good try. So this is a demo, although this exam looks like very simple and straightforward. And yes, you know, everything, the question statement is very straightforward. The options are very straightforward, although the exam is not that easy. I'm not trying to afraid you, but I'm trying to alert you. Try to think logically while solving any SBA. So A, femoral nerve, is the right answer. If you want me to share the explanation of this answer. Content. It's a general question about femoral triangle. So everything, I think you confused the femoral sheath with the femoral triangle. In the statement, I advise you to read the statement again. The question is, which nerve is most commonly at risk during surgical procedures within femoral triangle? They didn't ask about femoral sheath. If they ask femoral sheath, then yes, you can go for the option D. But this so this is a demonstration. This is how this exams looks like, and this is how you're going to tackle the SBAs. And Dr. Grishma already gave you this tip that read carefully the SBA statement, the question statement. Don't rush with the answers. Yes, Sarah, this is not about femoral sheath. This is about the femoral triangle. Because you guys were very confident that you know the whole information about femoral triangle, but this is not that straightforward. It just seems like straightforward. Yes, I'm gonna share the explanation. Give me a second. Sometimes I like when my candidates give the right answer. Sometimes I'm more happy when they give me the wrong answer because that way you learn more.
So Dr. Simple, do you
Yes.
recommend them to practice more SPS with you?
Yeah, exactly. Definitely. They can practice SBA with me as well, because when we discuss SBA, you would remember till the exam. Now this time you made the wrong answer. You will remember in the exam day that you made this mistake, and you will definitely remember this information now. So don't
So
take
do
it
you
easy.
also recommend them to join the premium group and practice the SBAs with us?
Yeah, definitely. This would now you imagine this is a group discussion and everyone involved in this discussion. So this is a way more easier way to remember everything, because this is not possible for anyone to memorize the question bank of 2,000 questions. This is not possible at all. So it's a good way if you participate in the discussion. I don't judge anyone by giving the wrong answer. I never judged my students. Instead, the candidates who made mistake during the discussion, ultimately their chances are better in passing the exam because they learn from their mistakes. But yes, for that, it is important that you participate in the discussion with us. You can practice as maximum as SPAs. And also, I have a tip. You can discuss the SPAs with any of your study partner. The purpose of our social media platform is not only just to provide you with the information, with the study material, and with the course details. Another important thing, you can utilize our social media platform as maximum as you can. You can find the study partners. For that, I would advise you uh, post a message in the WhatsApp or Facebook group that you are looking for a study partner. You can post your study timings the subject you are studying these days. And according to that, you can easily match any of your study partner, and you can practice SBS with your study partner as well. I used to do this thing. Okay, I'm gonna share the explanation.
So you're saying that if they join us, they can also have a study partner as well.
Yeah, that definitely. That's why I mentioned that it is a one-stop destination. Med Institutors is a one-stop destination for everyone. You're getting everything on single platform. Either it's our
So they're
Facebook, it's our
bits.
either it's our website or our Telegram group, even in the discussion class, in the teaching session.
So it's a lot of they're gonna be getting a lot of benefits if they join us. Like they're gonna get a lot of things on their plate, and instead of roaming around here and there.
Yeah, definitely. I wish I had such platform during my time. I really, honestly, I really wish that. Okay, I have posted the explanation. Have a look. I think it's posted. Let me read this for you. During surgical procedures within femoral triangle, the femoral nerve is most commonly at risk due to its close proximity to the surgical field. The femoral nerve is a major nerve that originates from the lumbar plexus, as I mentioned previously. The root value is L2, L3, L4. Easy way to remember, 2, 3, 4. And provides sensory and motor innervation to the anterior thigh muscles. That's understood because it is the major nerve of the anterior compartment of thigh and the skin, thigh, and leg. It runs within the femoral triangle alongside the other structures, as I mentioned, femoral artery and vein. Surgical procedure in this region, such as femoral artery catheterization, lymph node dissection, put pressure or damage the femoral nerve, leading to sensory deficit, weakness, paralysis in the distribution of the nerve. Therefore, the surgeons must be cautious and aware of the anatomical relationship to avoid injury the femoral nerve during procedures in the femoral triangle. That's it. I hope this is making sense to everyone. If you understand this, please do let me know in the chat box that you are clear about this SPA so that we can move on to the next. I'm waiting for your reply. Okay. Steffi, you are confused about triangle sheath. Okay, let me repeat this for you. Basically, it's not triangle sheath, it's femoral sheath. It is the covering, it is basically sheath means the fascia. And the purpose of the fascia anywhere in the body is to hold the contents, hold the muscle. So this is the sheath, the fascia from the abdomen, which is derived from the transversalis fascia anteriorly and the iliaca fascia posteriorly. It comes down all over from the abdomen and enters into the thigh. And it holds the structure including femoral artery, femoral vein, and the lymph nodes of the femoral triangle. Which structure which doesn't covered by the sheath is the femoral nerve. That's it. These are the high yield point from the femoral sheath you need to remember. Don't confuse with the femoral triangle. Am I clear, Steffi? Okay, I have posted another SPA. This one is the easy SPA for your motivation. And I'm sure everyone knows the answer. I'm gonna read this for you. Which structure forms the roof of the femoral canal? Option A, femoral artery. B is the femoral vein. C, lacunar ligament. D is inguinal ligament. Anytime, Steffi. Feel free to ask any question. Any better answer? Okay, so I'm gonna tell you the right answer. Xiaomi, it would be appreciated if you rename your name. In that way, I would love to remember the names of my students. So I don't know who are you. Xiaomi M20, Dr. Neab, Dr. Sarah, Dr. Faiza, Dr. Mona, Dr. Samira, Dr. Noor, Dr. Khatija. Well done, your answer is right. It's inguinal ligament. D is the right answer. Tota and Faiza, best of luck. Better luck next time. Oh yes, Tota is also right. Superior inguinal ligament. Yeah, well done. Dr. Faiza, C, lacunar ligament is not the right answer. That's another SPA. I don't want to mess with your head, so I'm keeping some information to myself. Why C is not the right answer? Basically, let me tell you, lacunar ligament is the medial border of the femoral canal. It is not of the femoral ring, sorry. It is a medial border of the femoral ring, so don't confuse this with femoral canal. However, D, it's a very pretty straightforward question. Inguinal ligament is the right answer. Don't worry. Okay, this is the last SPA from today's topic. I'm gonna share. The question is, which structure is located at the apex of the femoral triangle? A is the femoral artery, B is the femoral vein, C is the femoral nerve, D is the lymph node. Okay, I want the maximum answer so that we can wind up today's lecture. Okay, if you guys are done, I'm gonna share the right answer. Okay, so okay, Dr. Khatija, Dr. Sarah, Xiaomi again, and Mariam, Dr. Mariam, well done. A is the right answer. Femoral artery is located at the apex of the femoral triangle. It passes beneath the inguinal ligament at the midpoint of inguinal ligaments line from the pubic tubercle to the anterior superior iliac spine. This location makes it a key anatomical landmark within the femoral triangle. So A is the right answer. So once again, although this exam looks like very simple, pretty straightforward, but this is not the case with the actual exam. I'm sharing those SBAs which are according to the RCOG curriculum and the RCOG format. So this is how they are going to trick you on the exam day. And we are really working hard on our website, our study material, our question bank, our recalls with the help of RCOG examiners. And we designed our premium study course with the help of those examiners. And we keep in mind every challenges that might every candidate face during the preparation. So I would highly recommend you to practice SBAs as maximum as you can. And we have already give you the details of our study package, what kind of study material you're gonna have, what kind of benefits you're gonna get from our study course. And we tried our best to make this study course as innovative as we can. We introduced many new things, as I mentioned about the subject-wise recalls, which is the first time we are going to launch the subject-wise recalls. They were never been in any social media platform before. And the second innovative thing we are going to announce is the mini study schedule, which is on the weekly purpose, which is personalized according to the every candidate's need. So that's really beneficial for everyone who are taking the course. So Minhal, I think we are done today's lecture. So if you have anything in your mind, please you can share your thoughts.
That was a wonderful session, Dr. Sumbal.
Thank you.
Thank you so very much for guiding your students, and we will see you in our next session. Thank you. Bye.
Thank you. Bye. Bye, everyone. I hope this session would be beneficial for you. And best of luck with the exam. Bye bye.
Bye. Good day.
Good day.